Randy here. I wanted to talk to you about working out while you're pregnant and some of the changes your body goes through. So the intention of working out when you're pregnant is to keep your body working well so that labor goes easily and to prepare for motherhood. So a few effects that pregnancy has on the body is our diaphragm. Our diaphragm helps us to breathe and it needs to move in and out. So as that baby grows, it becomes more difficult to breathe. Our transverse abdominis, those are our lower abs. When we're pregnant, again, they're being stretched out. So we need to take great care in making sure that we train those accordingly and make sure not to put too much pressure on that. Our multifidus, so that is the muscles that come down our spine. When we're pregnant, our posture with the growing baby tends to be a lean back to compensate for this growing belly, leaving our back in a position that is not ideal. So the muscles on our back need a lot of extra care because our posture is in that lean back, which also puts our pelvis into a tilted position, which can put strain on our organs. The linea alba, which runs from here all the way down, it connects our two sides of our abdominis together with our linea alba. As that baby grows, that's stretching out. These are stretching out. There can sometimes be a gap. If that gap becomes too much, especially after pregnancy, you'll notice that sometimes you get a diastasis. That's a problem that we want to try and avoid as best we can. So working out while we're pregnant is something to do, but make sure that we're keeping aware of our linea alba and our recti. The hormones, lots of hormone changes happen when we're pregnant. A really important one to take note of is relaxin. So relaxin helps to stretch all these muscles that are stretching, make room for the baby, make it easier for the baby to come out. That can also make stretching seem like you can stretch much farther than you can. So while working out and while stretching, you want to be cautious not to overstretch it and then pull something. And of course, the most important muscle, in my opinion, our pelvic floor. So that's way at the bottom. That's where the baby's eventually going to pass. And our pelvic floor, it holds up our organs, it holds up our baby, it holds everything in. So normally our pelvic floor, it holds about 1 to 3 pounds. That would be our organs. With that baby in there, it's now holding 14 to 24 pounds. So it has a lot more work that it needs to do. So we need to be very cautious. When you have pelvic floor dysfunction, it can lead to pelvis pain, it can lead to incontinence, and it can lead to a lot of other issues. So you want to take very good care of that pelvic floor along with all of these other muscles. So just a quick what to look out for while you're working out and why it is so important to choose a proper pregnancy program that is going to help you take care of all of these super important muscles and, of course, keep you healthy and your baby healthy.